Hi, this is chapter 26 in the MDA book. This is the patient's dental record. So the patient's dental record, also referred to as the patient chart, is a complete history of the individual's dental care from the first date of service through today. Whether you're communicating with the patient by phone or in person, the patient's chart should be available for reference. That way you can refer back to any date of service and have a complete record of what happened at that appointment or during that conversation. The patient's record is always organized, or should always be organized, in a specific order. When it's a paper chart, it's typically organized so that on the left-hand side of the chart, you will have the patient's personal information. And then on the right-hand side, you're going to have the diagnostic findings on the top, and underneath you'll have the documentation of the treatment. In electronic dental records, they can be in different formats depending on how the electronic record is set up. So the patient record is the first step in providing total care for your patient. It can be used for personal information like contact information and medical conditions, dental information such as past procedures or what treatments are necessary in the future. So there's something called permanent ownership. The dentist is the legal owner of the patient's physical or electronic record and the information contained in the record. But remember that patients have the right to review and retrieve that information. So they do have to have permission from the dentist to review and retrieve that information because the originals are always going to stay at the office, and we're going to give copies to the patients. The reason for that is because they can be used, the originals are legal documents and can be used as evidence in a legal settlement or a lawsuit, or as reference for an appropriate third parties like dental insurance companies and government aided programs, or as a reference tool in a forensic case for evidence in identifying an individual with the use of radiographs or study casts. Remember the privacy part, that a dental record contains confidential information related to a patient's personal information, health, and financial background. So we have to remember HIPAA, and that a chart contains PHI, which is protected health information or personal health information. So with that, there are two areas of PHI related to the patient dental record: the personal information, which include identifiers like name, date of birth, gender, ethnicity, emergency contact information, address, phone numbers, email, health insurance, and financial accounts. Health information like diagnosis, treatment, laboratory results, and prescription information. So HIPAA enforces the physical, technical, and administrative safeguards that must be implemented. Examples include encryption of software, firewalls on all computers, and all paper records and electronic devices maintained in a locked environment. Staff who have access to PHI should complete security access and awareness training. So HIPAA requires that all dental practices today have a written privacy policy, and that policy must inform the patient that the office will not use or disclose protected health information for any purpose other than treatment, diagnosis, and billing. The privacy policy is written and prepared in a written or electronic format and must be provided to every patient to review and sign, and an acknowledgement that they have received notice of privacy practices. It's kept on file in the patient record for a minimum of 6 years, and you need to know that. With quality assurance, quality is the key word to remember that when a patient is receiving dental care, they need to receive quality dental care, and quality assurance is what offices do to assure that patients are receiving quality dental care. So they do complete routine forms for each patient and verify these forms with patient signature and date. They see patients for timely recalls, so that's seeing them at least every 6 months to make sure that their dental needs are being addressed. They have a completed dental record kept for each active patient in the dental practice. They make sure that documentation includes information when radiographs are taken. Current up-to-date emergency protocols are adhered to by the dental team, and current and up-to-date licenses, registrations, certifications, and training of dental team members are maintained. So with risk management, proper documentation helps avoid litigation. Risk management basically is for dentists or doctors to avoid litigation or going to court for lawsuits. So as noted earlier, the dental record provides documentation regarding a patient's clinical findings, diagnosis, treatment plans, and response to treatment. So for a dentist to avoid litigation, like a malpractice lawsuit, in the process of outcome of treating a patient, records have to be kept organized and complete with all of this information. And records can be used for research. A complete and chronologic order of a dental record or a specific dental condition that has been diagnosed can provide data to be used for research purposes. With dental record systems, so we have paper dental records that are inexpensive initially and easy to customize. However, it's a continued cost. So if you have paper dental records, you're always buying more charts, more folders, more papers, pens to write in those charts, things like that. So it's a constant cost of overhead, which overhead is a cost above and beyond that of the patient, for the care of the patients. Or they could have an electronic dental record. It's more than 75% of practices now use some form of an electronic record. Even if the whole chart isn't electronic, a portion of the chart is electronic. So benefits of going paperless include access to the dental record is safeguarded because you don't have this physical chart that can be picked up by anyone and looked at. You have to have credentials to sign into the system to use it. It allows you to perform practice management and the dental team to enter relevant clinical documentation and prescriptions right into the computer and share health information with authorized providers because the system can be accessed in more than one point. So multiple users can access the chart at one time, where if it's a paper chart, if I'm looking at the chart, you can't look at the chart unless you're looking over my shoulder. But if it's an electronic health record, then we can be at different computers looking at the same chart. So with components of the dental record, we have a patient registration form that contains information related to the patient demographics and financial responsibility. The patient is asked to provide information of all of their demographics, their insurance information, their responsible party, and the signature and date on the patient registration form. On the medical dental health history form, it's for the dental office to provide safe and dental care, and the dental team must ensure that all necessary and significant medical information is obtained prior to initializing treatment. So the patient fills out this form prior to treatment, either in electric or paper format. It's regarded as minimal information, and you need to know that. So minimal information from a patient, and it should be collected in a systematic order. So once it's been completed, the adult patient who completed the form or the patient's legal guardian must sign and date the form to confirm that the information is correct. It is your responsibility and the responsibility of the rest of the team to review that form and initiate conversation and ask questions to gain greater insights into the patient's well-being. The medical alert information is, after having received that completed medical and health history form, one of the first priorities is to review indications of health conditions, allergic reactions, and medications that could interfere or be life-threatening. Examples of that should be noted or updated include pre-medication, drug allergies, latex allergy, and pregnancy. An example could be a reaction to a specific antibiotic that can be prescribed for dental treatment. And we would inquire with further questions to make a note with a listing of the antibiotic that this patient cannot be prescribed. In the dental record, we would put a medical alert and any other precaution to be sure that the patient was not prescribed that medication. For patient registration, on this slide, it lists everything that is on patient registration, from the patient information, their insurance information, their responsible party, and their signature and date. Patient registrations can look different depending on what office you're at. You know, there are multiple different patient registration or forms of any form. There are multiple different versions of them that can be bought or that can be designed by the office. The medical history form, as I said earlier, they're questions regarding the patient's medical history, their present physical condition, chronic conditions, allergies, and medications currently being taken. So it's all about their medical history. With the dental history, it's about their previous dental treatment and care, and see how they feel about dentistry. You know, if they say something like, you know, I hate going to the dentist, then you know that this patient might need some extra TLC. How important is dental care to him or her? Do they just say things on their paper, on their medical and dental health history, like it's okay if I just have all my teeth extracted? Then you kind of know where their mindset is at and how much you may need to talk to them about dental care and how important it is to maintain their teeth. A medical alert. Like I said, this review indications of health conditions. So if we had a medical alert, like that would be if they were allergic to a medication, especially something that we prescribe often, then we would need to have that alert in there so that we made sure that we did not prescribe that medication to the patient and make them ill or worse. So we should enter that, any medical alert, into the dental record. If it was a paper chart, we would use an alert sticker on the inside of the record. We would never place anything on the outside of the record because that is a HIPAA violation. So the patient must update his or her medical and dental health history at every single appointment. Even if they came yesterday, they have to sign the update today because they could have had a doctor's appointment or an emergency in between the time of since the appointment yesterday. So health history information that may have changed could be a diagnosis of a medical condition or a medication. You know, if they were here yesterday morning and they come back this morning, they could have seen their doctor at 3 o'clock yesterday and their medications could have changed, or a diagnosis. We need to have that signed every single time as quality assurance. With diagnostic information gathering forms, we have the physical examination form, a radiographic examination form, and a clinical examination form. So with the physical examination form, this is the examination form that is going to be filled out for each patient as they come in to have their treatment done. The clinical examination form and recall examination form is the most detailed document in the dental record. This form provides the dental team with past, present, and future examination data, analytics, and charting needs for the patient. It's completed for every new patient and of the practice and is updated at every appointment, including recall appointments with the dental hygienist. So the dentist will examine the patient and dictate the findings to the assistant to chart or record. So as they call off these things, you will be charting them in our dental shorthand in red or blue pencil. So you'll have to know your dental charting very well and be able to do it quickly. So this is something that's important to practice in your Evolve resources, under your student resources in the interactive dental office. So with the clinical exam form, some things that you can chart on there are existing restorations and present conditions, periodontal conditions, which are presence of gingivitis or periodontal disease. The patient's chief complaint, you know, what is the major source of concern at that time? Why are they there? Or if they're scheduled for their 6-month recall, what is the major problem that they're having at that time? Findings of occlusal evaluations, meaning like, are they grinding and bruxing their teeth? Finding of temporomandibular joint evaluations. Are they having any problems clicking, popping in their temporomandibular joint areas? And any other comments that they may have about their visit. The treatment plan. So once the dentist has reviewed the medical and dental history form and has dictated any charting or updates needed on the clinical exam form, then they record the plan of care on the treatment plan form. So it's properly sequenced to address all problems that were identified during the exam and diagnosis portions of the patient visit. Treatment plans may change course if financial arrangements become a factor. So there can be multiple treatment plans for a patient. Now, that's because they can be different by cost. So there can be the optimal treatment plan, then there can be, like a middle treatment plan, and then the less desirable treatment plan, which is, maybe a patient comes in and has a lot of work that needs to be done. The most expensive would be obviously to have their teeth extracted and have all implants placed. The middle of the road would be to have all their teeth extracted and have a few implants placed and have implant dentures placed. And then the cheapest option would be to have their teeth extracted and have traditional dentures placed. So they may have three different three different treatment plans, but they're all replacing their teeth, but they're replacing their teeth different ways, and all of them cost different amounts of money. So these are three different treatment plans so that the patient can have teeth in the end, but they're going to have a different type of treatment. But you always need to have informed consent when you have a big procedure. So it's related to a specific type of treatment or procedure. Like if you're going to do something small, like a cleaning, you don't get informed consent because it is a different type of consent, like implied that they want treatment when they come in for a cleaning. But you're going to have informed consent if expected outcomes of treatment, if there's any possible complications that might occur, if it's going to be a big treatment plan, something expensive, something that takes a long time. It's commonly used for invasive or extensive treatment or any specialty procedure. So examples of that would be like a surgical procedure, orthodontics, like braces, endodontics, which would be like root canals, periodontics, and implants. So with progress notes, the treatment is recorded in this section of the patient record. Anytime communication takes place with the patient, with anyone contributing to their care, or at the completion of a procedure, the details are entered in the progress notes section. Specific information that should be included is the date that shows the month, day, and year of the treatment or communication. The tooth number, if a specific tooth is being treated or discussed, it should be indicated by the number in this section, and the information that allows faster reference for previous appointments. The treatment and the communication that you had with the patient. So it's very important that you put detailed information that you have with the patient. So if you did treatment, you need to put in what type of treatment you did. You can't just put number one filling. You have to put in, tooth number one, the surface, the materials you used, the type of filling that you did, how the patient tolerated the treatment, how much anesthetic you used, the type of anesthetic you used. You have to be very detailed in the notes in the chart. What kind of communication you had with the patient afterwards, did you go over home care instructions, things like that. When it comes to entering data in the patient record, again, you have to make sure that it is being entered as if it's being seen in a court of law. At the conclusion of the procedure, the details of what was accomplished will be entered in the progress notes section. And if you had to make a correction, Anything that's incorrect must be preserved. So we still have to be able to read it, even though you want it to go away. So we can't completely delete it. We can't scribble it out. We can't white it out. Just a single line through it so that they can still be read, initial and date next to it, and then write your new entry underneath it. And then there will be specific ways to correct those entries in electronic records depending on what system you're using.